everybody. Dr. Ortved here, Vet Triage. We are going through this issue of Veterinary Surgery. This is from April 2022. We are talking horses today. Computed tomographic assessment of fracture characteristics and subchondral bone injury in thoroughbred racehorses with lateral condylar fractures and their relationship to outcome. This comes out of University of Pennsylvania. The goal is to investigate the effects of fracture characteristics and concurrent subchondral bone pathology identified with CT scan on racehorses. They're thoroughbreds. They involve fractures of the metacarpal 3 or metatarsal 3 lateral condyle. Subchondral means the portion of the bone that's underneath the cartilage. So it's between the cartilage and when the bone starts. And then this image there on the bottom, just an example of a fracture. You can see the fracture there to my left, right here, this side. And then on this side right here is the fracture repair with 2 screws. So pretty cool repair there. And that's an example of a fracture. Retrospective study, 50 horses. They all had internal fixation, which is what that is, as opposed to external skeletal fixation, which has the implants outside the limb. And then the third category of fracture repair or management is external coaptation, which is a bandage or a splint. Results, 66% of horses raced after surgery. Horses with sesamoid bone fractures, so those 2 triangular structures, these right here are sesamoids. So horses with sesamoid bone fractures, those with metacarpal 3 or metatarsal 3 comminution, meaning that the bone is fractured into multiple pieces, not just 2 like in the picture there. Maybe that one has more than 2, but no, probably 2 in the picture there. And those with intra-articular fragmentation, meaning fractures that are associated with the joint, which probably is the case here. This fracture goes all the way down here to the joint. See that defect? So horses with those factors are less likely to race postoperatively. Having subchondral bone injury did not affect outcome. When comparing everything all together, sex and whether a fracture was incomplete or complete were the most significant predictors of racing post-op. Females are less likely to race, and horses with complete fractures, which is an example right here, were also less likely to race. Significance shows that CT can aid in preoperative evaluation and prognostication of enabling more complete fracture assessment. Introduction. Fracture of the third metacarpal or metatarsal condyles occurs commonly in thoroughbreds. Condylar fractures involve the lateral condyle most often, originating near or in the parasagittal groove and propagating proximally in the sagittal plane. The configuration of lateral condylar fractures range from simple and incomplete to complete and displaced. Many can be treated with surgery. More severe fractures are 25% of catastrophic injuries in horses in California. Condylar fracture are thought to be the consequence of repetitive cyclic stress, leading to accumulation of micro damage and formation of microcracks in the palmar and plantar aspect of the distal condyle. Previous work evaluating the limbs of racehorses euthanized after injury have demonstrated that pre-existing pathologies in the articular cartilage and the bone in the affected or contralateral limb. Pathologic fractures in the subchondral bone of the palmar or plantar aspect of the distal condyle is common in thoroughbred racehorses and referred to as palmar or plantar osteochondral disease. Palmar means the bottom portion of the thoracic limb, and then plantar is the bottom portion of the hind limbs. In this study, they chose to use the term subchondral bone injury instead of osteochondral disease because of the inability to confirm chondral pathology using CT scan. In more severe cases, injured or diseased bone can be identified on radiographs as areas of decreased opacity, meaning lysis, surrounded by increased bone opacity, which is sclerosis. Volumetric imaging modalities like CT allow for assessment of more subtle changes to subchondral bone. The degree of subchondral bone injury in horses with condylar fractures have been reported to be variable. Previous studies have also suggested that concurrent fetlock pathology, such as articular comminution and proximal sesamoid fractures, negatively affect outcome. These lesions are difficult to detect on plain radiographs. CT has been shown to be superior to conventional radiographs. Materials and methods. These cases occur between 2008 and 2020. Regarding CT scan, the horses were placed under general anesthesia, 1.25 millimeter slices. They used a board-certified equine surgeon and a board-certified radiologist to assess the CT. Fractures were characterized as either incomplete if there was no visible extension of the fracture through the lateral cortex at its proximal extent, or complete if the fracture could be seen exiting the lateral cortex. And so this fracture here would be considered complete. Fractures were also characterized as non-displaced if there was no malalignment of the fracture fragment noted, or displaced if there was any dorsal palmar or plantar or proximal distal malalignment of the fracture, and this would be displaced in this image here. Fracture configuration was oblique if the fracture propagated proximally and obliquely towards the lateral cortex, sagittal if the fracture propagated proximally in the sagittal plane only, or spiraling. And I would say this one might be spiraling because of of this here. So maybe that it's oblique, but it could actually be spiraled because it's not even. But I'm going to go with oblique for this one. To assess location of the origin of the fracture, the distance of the fracture from the mid-aspect of the sagittal ridge to the distal palmar or plantar extent of the fracture was measured in millimeters, characterized into 3 zones. Zone 1, 0 to 10 millimeters from the center of the sagittal ridge. Zone 2, 11 to 20 millimeters. Zone 3, over 20 millimeters. Subchondral bone lesions were identified as central areas of either linear, oval, or crescentric hypodensities, meaning lower bone densities, and that was consistent with bone lysis, within regions of hyperdensity, which is sclerosis. Results: 54% female, 26% intact males, left forelimb 34%, right forelimb 30%, CT analysis 64% incomplete, 36% complete, 74% non-displaced, 26% displaced, 72% propagated proximally and obliquely towards lateral cortex, whereas 24% propagated proximally in the sagittal plane only, 4% spiral. The median distance from the sagittal ridge was 9.3 millimeters, so 58% was zone 1, 40% zone 2, 2% zone 3. Median height of the fracture is 84.2 millimeters. 76% of horses had palmar or plantar comminution, 32% had dorsal comminution, 30% both palmar and dorsal comminution, 22% no articular comminution, 40% had free fragments in the joint. Free fragmentation occurred more frequently in displaced fractures. Makes sense. If it's displaced, usually there was more trauma involved, and in complete fractures, which makes sense. 30% of horses had lateral subchondral bone injury only. Another 30% had lateral and medial subchondral bone injury. 36% had none. 61% front limbs had lateral subchondral bone injury. 16% front limbs had medial. 16% front limbs had both. Whereas 59% of hind limbs had lateral subchondral bone injury. 44% of hind limbs had medial, and 38% had both. Of those that had lateral subchondral bone injuries, 97% occurred through the lesion. That's really high. Of those with lateral subchondral bone lesions, or bone injuries rather, 64% of the lateral subchondral bone injuries were crescentric, 33% linear, 3% ovoid. Of those with medial subchondral injuries, 59% crescentric, 35% ovoid, 6% linear. So here is some examples. So A is dorsal comminution, B is palmar comminution, and C is both dorsal and palmar. So you can see that there. They have little white arrows to show it. Regarding surgery, they use 4.5 millimeter cortex screws placed in lag fashion. Lag fashion, and I think it's probably lag fashion in the x-ray here, you place a screw perpendicular to the fracture site. So you can see here that this is perpendicular to the fracture line. And then place it in lag fashion, you can see how the head of the screw is kind of deep in the cortex here. It's not sticking out here. So what they do is they over drill the side of the repair. That way the screw head can get engaged in the cortex. So the size of the hole drilled here is going to be bigger than the entire length of the drilling that was done here. That's lag fashion. 12% of horses had one screw, 62% two screws, and that's this horse here. 12% three screws, 8% four screws, and 4% had 6 screws placed, 2% had 7 screws placed. So here's some more images as well. Boom. Showing how they characterize them. Complications: one horse had colic, one horse had arthrodesis post-op. Okay, regarding performance outcome. 66% of horses raced after surgery, 34% did not race. Of those that did race, they raced at a median of 296 days until their first start. Intact males more likely to make a post-operative start with racing than females or geldings. Complete fractures less likely to race. There was a trend towards horses with displaced fractures less likely to race. Horses with concurrent proximal sesamoid bone fractures less likely to race. Horses with both dorsal and palmar or plantar comminution less likely to race. Those with dorsal comminution only being less likely to race postoperatively, and horses with palmar plantar comminution trending towards being less likely to race. I mean, it makes sense. All this stuff says that the more severe the trauma, the more likely they are not to race. Horses with free fragmentation less likely to race. Presence of subchondral injury did not affect the outcome, which makes sense. If 97% of these horses were affected with subchondral bone injury, then it doesn't really make a difference. The two most significant factors post-op for racing were sex and completeness of fracture. Intact males were 22.8 times more likely to race. Horses with complete fractures were 90% less likely to race. Discussion. Radiographs have been shown to be far less sensitive than CT for evaluating fetlock joint after condylar fracture. Cross-sectional imaging allows for superior assessment of subchondral bone, articular surface, and fracture configuration. They found the presence of proximal sesamoid bone fracture, articular comminution, and free fragments decreased prognosis. Previous studies shown that horses with displaced fractures have significantly decreased prognosis for racing compared with non-displaced. Other studies show that horses with complete fractures are also less likely to race post-operatively. Horses with complete fractures were 90% less likely to race post-op than horses with incomplete, regardless of displacement. In similar studies, horses with complete fractures of the proximal phalanx less likely to race compared to incomplete. They found in this study that a smaller percentage of horses with displaced fractures raced post-operatively, which is 46%, compared with non-displaced at 73%. Previous studies describing radiographic findings in horses with condylar fractures have reported palmar or plantar comminution in 27 to 55% of horses. Another study in 2012 found comminution was missed in 42% of flexed dorsal palmar plantar radiographic projections when compared to CT scan. Previous studies demonstrate that horses with subchondral bone injury in the distal palmar or plantar condyles have a good prognosis with adequate rest, which presumably allows time for bone remodeling to occur. It has been postulated that subchondral bone injury may be protective against lateral condylar fracture by preventing horses from exercising at maximal speeds. Following a study in which subchondral bone injury was overrepresented in non-fractured lateral condyles when compared with fractured lateral condyles. Other studies have demonstrated that damage can be confined to subchondral bone, resulting in focal subchondral bone injuries, or can propagate into the trabecular bone, leading to fractures. In this population of horses in the study, subchondral bone injury and fracture of lateral condyle occurred together in the majority of horses. However, no unfractured control population was evaluated. As previously reported, in this study found that intact males were more likely to race post-op. Another study found that 72% of males and 53% of females raced post-op condylar fracture repair. Horses that raced post-op had a median of 10 months until their first start, which agrees with previous studies. In horses that did race post-op, there was a decrease in earnings compared to pre-injury, but this was not significantly found. So a pretty good study overall. I'm surprised I didn't go into more detail as far as like the variation of surgical repair, but I also wonder if MRI would be useful. MRI is very good at looking at cartilage And so I'm wondering if a future study comparing radiograph, CT, and MRI is indicated to see if you can figure out more detail with cartilage involvement. Obviously, you want a larger number of horses. You want a prospective study, and that's it. So good study there for those equine folks, and I'll see you guys in the next video. Thanks again for subscribing and supporting the channel, hitting like and all that good stuff. We'll see you in the next one. Take care.